As interpreter, there is a moment when you can stop. When you feel your patient is not being treated as a human being, or is not being respected, or is not being treated with dignity.
I put myself directly between the patient and the doctor. I'm no longer as a go-between them. I am now siding with the patient, and I can produce conflict. But I also has a great potential to improve patient situation.
I know I'm there for the patient, and I have to act for the patient's sake.
I graduated from nursing school in Russia, so I knew medical terminology very well, but I also had interest in words. My mother was an underground publisher and an editor, so for me words were always important. I immigrated from Russia when I was 19 in 1989. I studied Slavic literature and languages at Berkeley, and I realized that I don't want to be Slavic literature professor, that it's too dry for me, that I really love working with people. And healthcare interpreter seemed like a great match. You get to work with words, I get to keep my knowledge of medical terminology, and I know it sounds corny, but I help people.
I'm from Nicaragua, and I live in the Bay Area. 5 years ago, I was working for a medical clinic. I was doing filing, faxing, typing, and sometimes the doctors used to call me in the hallway to help them to do interpretation. So I started to fall in love with the interpretation part more than the filing part. But I knew in my heart that I was not a qualified or trained interpreter. So I heard about this program, and I got the information I needed, and I enrolled.
Our family moved to this country when I was 10 years old. And when I first moved to this country, I did not know how to speak English, but I had a lot of caring people that helped me out. When I was younger, I go to the doctor's appointment with my parents, and at times I would have to interpret difficult situations for them, or maybe embarrassing for them. And so I thought, okay, once I get into the workforce, healthcare workforce, I want to become an interpreter.
It's hard to find that middle way between compassion and professional detachment. I was 20 or 21, and I was a unit clerk. It's a medical secretary on a swing shift from 3 to 11. And I was not a trained interpreter, but I was used as an interpreter practically every shift I worked, because the hospital was short on professional interpreters. So I was called to a different floor. I came and interpreted for a resident and a patient. And the patient was an elderly woman. She was maybe late 70s, early 80s, and a recent immigrant from Russia. She had this grandmotherly look about her, long gray hair and glasses, and she was very frail. And the resident read her the consent form for very serious heart surgery. I think it was bypass surgery. And I interpreted the consent, and the resident asked her, "Do you have any questions?" And she said, "No, I don't have any questions." And she signed the consent, and the doctor left. And I was about to leave too, because it was very late in the evening and I had tons of my own work on another floor. And she just grabbed my hand and she wouldn't let it go. She said, "I must talk to you." And she said, "Detechka," which is a really beautiful Russian word. It's diminutive. It means like baby or little child. And that's how a grandmother would address her granddaughter, or some elderly person would address somebody who's much younger. And of course to her I was very, very young. I couldn't refuse because of the age difference, and my culture would be unbearable for me to say, "No, I'm too busy, I have to go." So I sat down. And she told me how worried she was about the surgery, that she didn't know if it was the right thing to do this surgery. I'm worried about my daughter, who just came here from Russia, and I don't know if it's a good idea to do surgery. Maybe I should just enjoy the months I have left and help my daughter rather than take the risks of being better. What if I don't recover from the surgery? At this point, I realized that something has to be done. I didn't feel like I could just leave it like this. But I also didn't feel it was right for me to convince her that it's a good idea to do this surgery, because I was just a unit clerk, I was not a doctor. I left her room and I went to the nurse, and I told the nurse that I felt very concerned that the patient seems anxious and is not sure if she should go on with the surgery. And the nurse at first was kind of reluctant to do anything. They're very busy. But as soon as she heard the story, she decided to call the resident. So she called the resident, and they all came back to the room. And I had a very long conversation with the patient. She had many more questions about surgery, far more than she had before when she just signed the consent. And after they explained risks and benefits in more detail, she said, I will go on with the surgery. She said, and I hope, I'll survive it, and I'll see you tomorrow in ICU, which is a bit of really dark humor for Russians. I did, in fact, interpret for her in ICU. She did the surgery, and everything ended very well. It makes a difference for someone to go into surgery really being informed and understanding what you signed, rather than the way this lady was going through that surgery. Years later, I can see that it was really cultural. She simply signed the paper because the doctor told her to sign it. That's what she would have done in Russia. If the doctor says something, you just do it. There was a moment there that I felt completely unsure and alone of what to do. And I don't think anybody should be in this position. Because I know if I had training, I wouldn't have felt this way. I wouldn't have had such a great anxiety. Am I doing the right thing? Oh my God, what should I do? If the patient asked me to stay now, I would have asked her, do you still have questions, which went unanswered? And she would have said yes. And I would say, I will bring the doctor back to you so we can discuss it together. I would have reverted to the interpreter role much faster now than I did there. Because I do think advocate role is one of those roles which should be limited. It's one of the most invasive roles, and there's that huge temptation just to say, well, I know what is best.
July 25th, 3 p.m. would be great.
In the medical field, some people have a misconception of being a low English proficient patient. Sometimes people are not willing to help and support the patients. That bothers me a lot. I was doing my internship in a county hospital, and I got a little familiar with this patient. This was a middle-aged Mexican patient. He had developed AIDS. I knew he was not fully aware of his situation in the hospital. He did not know for how long he was there. One time I was there to do interpretation to the doctor. The doctor did not really need my help. He asked me to stay in the room and wait for the social worker. The social worker came to the room. I was in the hallway by the room waiting for her. She whispered like, the patient has dementia. I need to get personal information from the patient. We don't know much about him, and he has been here for a while. They didn't know, not even his full name. They wanted to know the city where he lived before he got into the hospital. She needed to know if he has any relative willing to take care of him. And the patient sometimes will answer the question, sometimes he was not aware. The patient was very sad, Sometimes he used to talk about his mother and family from Mexico, but I couldn't let my emotions come out at that moment. I needed to get all the information to the social worker to help him. So he, at some point, told the social worker his family rejected him due to his illness. And once she found out he has no families to help him, she was looking for a hospice where he can be transferred. And at some point, the patient told her not to contact the Social Security office because he was using a identity who used to be one of his friends. and his friends passed away years ago due to AIDS too, because they used to do heroin together and they both were infected with HIV. And I see the social worker started to be rude, and she started to question at him, like, why are you doing wrong things? You know, why people come from different countries to do wrong things in this country. So she was like judging the patient instead of being supportive. And there is when I decided to stop and try to approach her in a positive way. I was really worried about my situation as interpreter. There was a big gap between the social worker and the patients. The social worker was African American, and as interpreter, I needed to, come in the middle and explain the social worker more about the patient's culture. I tried to be nice, and I told her the interpreter would like to talk to you about the patient and, explain you a little bit how it's to be an immigrant and how it's to be in a country where you don't speak the language. It's hard for immigrants to legalize their situation in this country. She gave me a chance to speak to her, and I was so happy that she has a nice attitude, that she understood my position, and she said, thank you for translating, and I'm glad that you are there not only conveying the message, but you care about your patients.
At times when I feel that the patient is not getting the treatment or the service that they deserve, that's when I step into the patient advocacy role. Chinese are very modest, and a lot of times that they don't want to expose their breasts or other private areas to strangers. I received a phone call from the receptionist in the radiology department in the morning, asking me if I was able to work in a patient because the patient was not scheduled with an interpreter, and she's requesting one for her mammogram appointment. And by the time I got to the radiology department, the receptionist told me the tech already took the patient back into the room. So I went and knocked on the door, and the tech opened up just a crack, and I noticed it's somebody that I've never worked with. This particular tech was not a Kaiser employee. So I introduced myself to her as the interpreter, and I was there to interpret for the patient. The tech told me that, oh, we're communicating just fine, I can understand her. And I proceeded to tell her that, no, the patient requests that I'm here with her. And the tech said, no, that's fine, we're doing just fine. And after a couple tries, I thought, okay, the patient had requested my assistant, so I proceeded to introduce myself through the crack and in Chinese, and told the patient that I'm the interpreter and I'm here now. And the patient was so happy and says, oh, I'm glad you can make it. Please come in, I need your help. So I told the tech that the patient is requesting my help, so please let me in. So the tech actually opened up the door unwillingly. And during the visit, the tech was a little bit rough and rude to the patient. And when the patient had questions to ask, and I was interpreting, the tech said, shh, be quiet. I cannot work and concentrate doing my work, so you cannot ask any questions. So after the appointment, the patient was complaining to me that she felt that she did not get the treatment that she should deserve and would like to file a complaint. So I notified the supervisor of the department, and I did not worry about my job because I know I'm there for the patient and I have to act for the patient's sake. Because if I just simply turn away, the patient will be dissatisfied with the visit, and they may not come back because of the bad experience that they encounter. If she didn't come back for the mammogram, what if she happened to get breast cancer and it is not caught at the early stage? Action was taken immediately. The supervisor spoke with the tech and reminded her the service that we're striving for. We want to give the best service to our patients. Here at Kaiser Fremont, interpreting services always do trainings to different departments. So the staff here are wonderful because they have training on how to work with interpreters. In the afternoon, I actually went back to the same tech with 2 other patients. I did notice there was an improvement of attitude from this tech. And I also utilized this opportunity to share with her on how to work with interpreters. I would advise the interpreters, if they face this type of situation, do not shy away and stand your ground and advocate for the patient.